Hey guys, it is Adrianne, and it's the middle of the night, like it usually is when I make these videos, but alright, we've got a couple things to talk about. So this video is for my nursing students. We're mid-September now, so we're partway into the semester, and this is usually the time of year that nursing students start clinicals. At least we did in the school that I went to. So I know that my first semester of clinicals, we were in a nursing home, then we stepped it up to med-surg, and then we did mental health, OB, and maternity, and then my final, my cat is nowhere to be found, and then the second I start this video, he's over here trying to get pets. So let me give him some scratches, send him on his way. All right, so anyway, clinicals are about to start, and clinicals can be kind of rough. I mean, they're pretty brutal. At least for me, I did clinicals all weekend, so I would work during the week, have school during the week, and then I would have clinicals on the weekend. So started in the nursing home, worked my way up to med-surg, like I said, and then finally did half of my senior semester on ortho and then half on neurosurg. Well, I say neurosurg loosely. It was not a hospital that took really, really acute patients, so it was very different to the neurosurg that I was used to at the university. Nevertheless, I had a variety of experiences at clinical, and regardless of where you're at, I think there are some things that can be helpful no matter what. So let's get into 10 tips. I have a list on my phone because I would never remember all of this. It's 2 in the morning, so my battery's almost dead, so I'm going to try to get through this pretty quick. All right, number 1. Find a way to eat before clinicals start. I was like, I can't eat in the morning. I'm not awake. It doesn't make me feel good. It might be a long time before you get to put anything in your stomach, and it's really hard to concentrate and take care of other people and do things that are new and scary and require a lot of thought when all you can think about is your stomach growling. Eat something, put a protein bar in your bag or in your pocket or something. Just make sure you eat. I'm someone who, as a night shifter, I like to eat just not breakfast food. So, I'd wake up before clinicals and make myself some tacos or something. Whatever you need to do, put food in your belly to fuel your brain and your body. All right, so number 2, when you get there, take every opportunity. Don't try to dodge tasks. Don't try to get out of things. If a nurse or your instructor says, hey, do you want to go down to see this test or this procedure? Your answer is invariably yes. You might be scared. You might not know what to do. You might not know what to expect. But you need to say yes to all of those opportunities. And if it's something that seems scary and hard, then you absolutely need to do it, because clinicals are the time to get as many scary, hard things under your belt as possible while you've got a ton of people around you that are supporting you, other nurses, professionals, instructors, etc. So now is the time to see as much as you can. I got to go into the interventional radiology lab when I was in clinicals, and I saw them place a filter in the inferior vena cava, and they did it on a computer that, like, the screen of this computer was the size of a car. So it was pretty impressive to see, and I haven't had an opportunity to do anything like that since, so don't miss those shots. Number 3, if you're doing well in clinical, help your peers. Now, that doesn't mean you go around and offer people unsolicited help, but if you see someone struggling, do your best to help them out, not in a know-it-all way, but in a way that genuinely is to help them succeed at that task. Teachers and instructors notice informal leaders. They're going to notice whether or not you're someone who just naturally is able to teach, help, and be that resource for your peers. So yeah, and it's a great way to reinforce material as well. If you're helping someone else learn how to do something, then you're just strengthening your skills in teaching them. So number 4, don't partake in negativity. I didn't do well at this. I caught myself getting really wrapped up in complaining, because it feels good. It's a good way to vent. But make sure that you don't spend all of your time just being in a bad mood. You're going to be tired. You're going to be spread thin. This is stressful. It's hard. I wish it wasn't this way, but we all go through it. And you need to remember that you need to be grateful that you have this opportunity. It took me a long time to get into nursing school. And so I tried to remember every time I got frustrated, yeah, I'm really irritated right now, but I could not be here. I could potentially still be working my job with no potential for growth, and that usually knocked the bad attitude off my shoulders. So try not to engage in the gossip or the bitching, but if you really need to vent, try to do it in a way that's constructive. You can let your feelings out, but don't do it in a way that's just like a group in the hallway after clinical bitching about somebody else. So don't do it. It's bad for your soul, your spirit, whatever. All right, so in preparation for clinical, we have to do care plans, and we usually are assigned a patient, maybe two, depending on where you're at in your study. But if you know that your patient has a particular pathology or illness, go in to your first day of clinical with that patient having some short list of interventions in mind. Like, for example, I, spend a lot of time on ortho, and one of the things that people do after hip surgery, knee surgery, whatever, they get up and they get out of bed. Early mobilization is the best way to get that new joint working and keep your muscles from seizing up and to get the process of healing started. Even though it seems horrible to get somebody out of bed few hours after they've had like a rod pounded into their bone. But really, that's the way it goes. So when you walk into a situation like that, you know that, oh, I'm going to, do some range of motion with this patient. I am going to, protect them as a fall risk. You just kind of have some things in mind that you're going to have to be able to talk about, because you know that eventually your instructor is going to call upon you and say, tell me about your patient. What are you going to do for your patient? Why are they here? What's important for them? You don't have to necessarily be able to talk about this for lengths of time like I do, but just be able to say a few things. Be prepared. And that'll build some confidence for you as well, because you don't walk into this situation, on the spot going, what do I do first? If they're having trouble breathing, sit their head up. Is there nasal cannula in their nose? Like, just think about things that are going to be your response to a potential situation with this patient. Okay. That got long-winded, and I'm not sure if that was confusing or not, so I'm sorry. Number 6, pack your bag smart. Now, I am an overpacker. I've been this way my whole life, but have, excuse me, have some basic provisions on hand for yourself. Make sure you have ibuprofen. I like to have a nail file in case, like, my nail chips, so that I don't scratch all of my patients. If you have a cold, have Kleenex, have your cold medicine, whatever. Make sure that whatever's in your bag is going to get you through your day, because sometimes those days are really long. They're even longer when you realize nobody there has a tampon and you need one, or, nobody there has any headache medicine that they can give you, because just because you're in a hospital doesn't mean you can just go to the medication room and take, some ibuprofen if you want it. So be prepared. And if you don't want to carry a bunch of crap, talk to your other, comrades, friends, co-students, and find out, okay, you always got ibuprofen on you? Well, cool. I'm going to eat your ibuprofen while we're there, and tell you what, I'll bring some extra bottles of water, whatever. Collaborate, co-op it, whatever you need to do to get through. Let's see, number 7. Save yourself a lot of time on your care plans by making a master medication list. So what does that mean? I'll try to be brief. We did care plans where we had to, as part of the care plan, we had to go through that patient's medication list out all their medications, what it is, what the action of it is, what the potential side effects are, what the negative, the adverse reactions are, et cetera, et cetera. So every time I would do a care plan, would have to look up all of this information, and it was tedious, and I would, start to doze off at the computer. So I wish I had realized it first semester, but after I think like second semester, I started keeping just a master spreadsheet, and I kept them alphabetized, and every time I did a med that I knew wasn't on the list, I would copy and paste all of that information into my master spreadsheet, so that as time went on, I built this bigger and bigger list of resources that were in my own words, that had citations in them already, that all I had to do was copy them. But the thing you have to be careful about is you have to amend it to fit that patient. Like, for example, if it's a medication that causes birth defects in, pregnant women, obviously you're not going to cite that as an adverse reaction if your patient is male. So just make sure that you're keeping a master list that has all of the basic information that you want for your care plan, whatever they're requiring, so that as you go through the semester, you can just open that spreadsheet on your desktop every time you start to work on a care plan, and you can just add and take information as you need it, rather than each time having to create that information out of your drug book, which is this thick. So that's my recommendation for that. Okay, we're getting to the end here. Number 8, drop the attitude. Ugh. Sounds so negative when I say that, but really, we're all sleep deprived when we're in nursing school. We're spread thin. We don't get to see our loved ones. We're stressed. We're dealing with all this information that is new and overwhelming. But you know what? Nobody likes a complainer. And let me tell you, I complain a lot. I recognize how much I complain. I try to minimize it, but you're going to get annoyed by the staff, the nurses. You're going to feel like they're treating you like dirt, or maybe, maybe not. I hope not. But I feel like there's always negative situations that are going to arise, and you need to accept the fact that you, in order to succeed and stand out as a great student, you need to bring your A game every single time. If that nurse is shitty to you, guess what? You be extra nice, you get all your shit done, and you don't let it faze you. If you need to go home and cry later, barely make it to the car before you burst into tears, that's fine. But keep it together. I don't do that very well. I strive to do that better. And I am getting better at it as time goes on. But, bring your A game every time. Number 9, find your people. There are lots of different personalities in nursing school. We have a diverse array of people that like to go into nursing, both straight out of high school, as a second career. I did it not as either one of those, but I wasn't in school for a very long time, and then went back and got my nursing degree in my mid-30s. But find people that are like you. And I don't mean like you, like, they look like you, they act like you, they live where you live. But I mean, if you notice that someone is always sitting up front where you are, and they always seem to have their notes together, and they're engaged like you are, and they seem to get things and talk in the way that you understand, try to make contact with them. Clearly they have a style, that might help you out as a study buddy, or just someone to bounce ideas off of. That's not to say you shouldn't interact with people that are different from you, but find the people that are going to help bring out your best qualities and help you excel. And if you're benefiting from them, hopefully there's some way that they can also benefit from your personality, study style, whatever. And finally, number 10, look the part. Now, this is not a vanity thing. This is not to say have like amazing makeup and the fanciest scrubs and really expensive shoes. But what I am saying is you need to look professional. You need to look clean. And even though you're exhausted, please, please don't pick your scrubs up off the floor. Dust off as much cat hair as you can, and then stumble into work with a shitty top knot on your head. You want to be a nurse? Look the part. Be clean. That's not to say you can't express yourself. You can have your top knot, but don't look like you haven't showered in 3 days. You're here to take care of people. You're You've got to keep them clean. You've got to keep them feeling like they trust you. So please don't look like you just came in from a hard night of clubbing. And fellas, don't look like a grizzly mountain man either. Keep it clean, follow your school's dress codes. Some dress codes seem really stupid. Like, I really didn't like that my school made people with visible tattoos cover them. I feel like if you have a tattoo on your neck, that a giant gauze bandage looks way nastier than a flower tattooed on your neck. So every school has to make that decision for themselves, and you're going to have to go along with whatever their dress code is. But look nice. Clean nails. Your shoes don't have to be brand new, but please don't come in with like mud and dirt and shit all over your shoes. Look the part. And as you go through your clinicals, as you're scared, you'll start to feel more and more confident. And if you know you look confident, then, I mean, that's half the battle, right? Fake it till you make it. Yeah, so those are my 10 tips. Hopefully they're helpful to some of you. I'll do another video later on some study tips and care planning tips, but I just wanted to get that all out for you guys who are going to be starting clinicals, or if you've already started clinicals. I'm curious to know if these are things you're already doing without me having to even tell you. Anyway, guys, leave some comments down below. Let me know what you find helpful. Share your thoughts and ideas. And if something that I've said is not helpful to you, tell me why. Let's get a conversation going. And in the meantime, good luck in all of your endeavors. And I hope that clinicals are an amazing experience. They might be hell as you're going through them, but you'll look back on them fondly, and you'll also learn more than you probably realize in the moment. So, yeah, happy nursing, guys. Bye.